Good evening, everybody. It is my pleasure and honor to introduce today my lifelong friend, Dr. Florian Balta. I'm interviewing him in this series of interviews for our friends all over the world. The Egyptian Veterinary Society is very pleased to introduce Dr. Florian Balta. Florian Balta is, I'm not exaggerating, is #1 veterinary retinal surgeon in Romania. And Romania is one of the very beautiful countries that is not very well discovered by everybody. Florian, I knew him since a long time, and I know about him that he is not only a most clever surgeon, but he is also a very superior human being, very humane, very honest, very sincere with his patients. And this explains why patients from all over Romania and the surrounding countries travel long distances to have his services. Florian, we are very much pleased to have you with us in this interview.
Thank you very much for the invitation. For me, it's a great honor and pleasure. And I'm very comfortable that you are interviewing me because we know each other, I think, in the last about 20 years or so. I think the first time you came in Romania was about 20 years ago, when I was more or less at the beginning, but in the meantime, we met each other many times, and we cheered this friendship. So thank you very much.
We thank you for being with us. I just forgot to add that Dr. Balta is now the president of the Romanian Ophthalmological Society, the elected president. I hope this is not too much burden for you over and above your work. Let me ask you a few questions about yourself and about your beautiful country. First, about yourself. How did you end up becoming a retina surgeon?
In this respect, in this aspect, I would say like this. My parents are physicians, and I decided as a child to become a physician. Of course, first I want to be a driver, and my father told me, "You will drive your car?" Yes, of course. And then I liked a little bit the football, and then I said, "Okay, I will be a doctor for a football team." But this, in the beginning, they passed, so I decided that I want to become a doctor. And I have to say that my mother worked as an ophthalmologist for a period, for about, let's say, 10 years or so. And because it was very difficult for her to have a job in Bucharest, he moved to another area. But when she moved to Bucharest and she was a teacher in high school, he practiced a little bit the ophthalmology, so in the Bucharest Eye Hospital. And in this way, I had the idea in the summer before the last year of medical school to go to the Bucharest Eye Hospital to see if I would like to be an ophthalmologist. and I met there the senior lady doctor that helped me to do the first step. And so I wanted to be an ophthalmologist before finishing the medical school. So I would choose ophthalmology everywhere in the country and not everything close to Bucharest, because the residency was difficult uh, to obtain a job. And I passed this exam and I started to be an ophthalmologist. And very in the first year, because I was doing some, of course, voluntary work in the hospital. I knew the people there, and at a certain moment, it was open a position as a junior assistant at the University of Medical School. And I knew that it could have been for somebody more interested to have this job. And I contact her, and she told me that she doesn't like ophthalmology. She will not go to the exam. So I did go to the exam, and I passed this exam, and I became, as I said, the junior assistant at the University of uh, Medicine and Pharmacy in Bucharest. Then it was a period where I did the 3 years of residency, and in the last year I had a fellowship from Professor Ingrid Kreisig in Tübingen, Germany, and I spent about a little bit less than 4 months there, doing the first step in retina. Then I came back to our hospital, and I offer my very uh, very basic knowledge of try to treat retina to my colleagues, and most of them, they were very happy to get rid of retinal detachment, as you can imagine, back in '93. So when I start to be successful, because of course, if you, as I learned from Professor Kreisig, the retina is very logical, and if you follow the rules, the results are coming. And when I start to be successful, many of the physicians say you go only there. So it was a high pressure in the beginning, and I work with the residents in the hospital, and many of the residents I work with, they start to be kept in the hospital. And now we are many doctors treating retina that were my residents, because it was a big need. And of course, we know that this area was developed in the last, let's say, I don't know, more than 30 years, but it was a new field that developed a lot. And we did go with the tendency, and because of the pressure, because we were few specialists in retina, we did operate a lot. Myself and my colleagues also, um, uh, and the technology helped us a lot, because we could do more surgery and more uh, and better results in less time. Um, and now I could say that even there is no name of a department of retina. We are right now like 6 doctors doing retina in our hospital, and of course there are some other doing operating retina in other places that visit us or work with me for a while. So I think at a certain moment, because we had help also from industry, we were quite um, up to date with the technology. So we are using the 25G instruments, I think, from 2010. And most of my colleagues, they switch from 20G surgery to 25 in one day, because the technology, of course, is good and it helps you. And I would like to mention did a short period I was with Dr. Weeks, and also we had a lot of help from doctors from America under Humana Foundation that did the entire program for ophthalmology that helped us and also in the country other doctors a lot in that period where we didn't had they give us a laser and they give us the opportunity to visit them, and most important were the visit of doctor from America in our hospital because we could work here. And
Florian, you have kindly answered my what was my second question, which is the what I'm witness of, which is the evolution of ophthalmology in Romania which was very quick in the past few years. Let me move in the few minutes before your presentation. Let me move to the to 2 points. I would like to ask you about yourself as a person, your family, your hobbies, and I know that you have also a certain theory about food. So if you can give us an idea, quick idea about this aspect of yourself.
Mm-hmm. So I'm married with Irina. We are friends from high school, and we have 2 boys. The older one, Alexander, just obtained a position as a lecturer in the University of Theater and Film in Bucharest. He's in completely other area than me, but during the time he helped me a lot with this, let's say, multimedia aspect of our job. He actually helped me he built a 3D system before having the Ingenuity system produced by Alcon, and the younger, we are very lucky. The younger finished the medical school and start to be last year resident in ophthalmology. And I like to say that he was the first who chose ophthalmology in his series, so he has a good note. So I'm confident that he will very likely be a very good ophthalmologist.
And what about your food preference? Because I guess this might be interesting.
Yes, I think this could be an advantage in Romania. We can still have a lot of access to uh, non industrialized food. We still have the opportunity to have, I would say, normal food without any ingredients. We know that it can be very good. I cannot comment more than this, but I like that we can do this. Of course, maybe it's a more expensive alternative, but I think it's a very important one. So usually we don't buy food from the
You,
from the big
you plant your own food, I
shops
understand.
and process it. Actually, we don't have to process it too much, but yes, something like that. Although I had some problems with the weight in the last year, but I hope I can manage that. I was better few years ago. Um, and of course, one thing that I've discovered some time ago that I'm continuing to advocate, it's the importance of the vitamin D. The deficit of vitamin D, it's probably very likely pandemic. Now with the pandemic, many people heard about this, and I hope they will keep going to take the vitamin D, which I think it's another very important part related to the health in general. And what should I say? Of course, people know that I'm operating a lot. They sometimes ask themselves, how can I do this? I don't know. I have energy, and the vitamin D, I think, helped me. And not much time for hobbies, but I have to mention that I was a professional chess player during high school. And recently I started to play a little bit. It was even a tournament organized in our university, which I like. Of course, I was not going too far because the younger one are are very good. But I like to play chess, and I start to look a little bit on this, and more or less, I think this and my hobbies. I
Great.
cannot say
For the sake
except
of time, for the sake of time, I know that you have prepared some interesting presentation, but I also know that you have prepared some photographs for beautiful Romania to show to us and to our audience. So, uh, would we start with the photographs of Romania and then we move to the presentation?
yes. Uh, I think they are. So first of all, about Romania, I think it's from the geographic point of view, it's very equilibrated country because in the center, like a sea, like a backbone, there are the Carpathian Mountains, and that means that one third are mountains, one third are hills, and one third are plains. And because the Danube, it's our southern border, and go to the Black Sea, there is the Danube Delta, which is very special. So we have a delta very close to Bucharest. We have the mountains very close to Bucharest, and there are many places that are different and very nice. Um, you have been to Sinaia, which is the closest city in the mountain from Bucharest, closest from Bucharest, where our congresses are organized. Also, a little bit farther, it's Poiana Brașov, which is also very nice. And the cities in Transylvania also are very, very special. They developed a lot in the last 20 years. And they are also in the north, in Bukovina, there are some famous churches with Albastru de Voronezh, blue of Voronezh. It's famous, I think, and I could say that I visit Romania, and I think I have seen many places which are very nice and they are different. So I'm sure that many people would appreciate the same as I appreciate Romania. I think it's a very nice country.
Thank you very much, Florian. And to our audience, we have finished the first part of the interview, which is the social part. And now we'll have a short break and we'll return back with our guest, Dr. Florian Balta from Romania, for the presentation or the scientific part after the short break. So we welcome you all back to the scientific part of our interview with Dr. Florian Balta. Please, Florian, go ahead.
Thank you again for the invitation. Great honor and pleasure to be with you and try to present you. So this is a special case I choose to present. It was a challenge, and it's a young lady that after a Valsalva maneuver came with preretinal hemorrhage in the posterior pole. And we could see with the OCT that it was a macular hole and retinal detachment in the posterior pole, and the hemorrhage was under the ILM. Here you can see the OCT with the macular hole and the hemorrhage and the blood under the ILM. And again, we can see the detached retina in the posterior pole and the hemorrhage under the ILM. The visual acuity was around 0.2, 0.3. And of course, we decide that we try to fix that. And we did the 25G vitrectomy. We are placing the valve trocar at 4 millimeters from the limbus. We check the position of the trocar in the vitreous cavity, and we place the cannula. I am using the Ingenuity system with the constellation from Alcon. Here you can see the the posterior pole with the hemorrhage and the hemorrhage under the ILM. Of course, we did the core vitrectomy, and here I create a small break in the cortex, in the posterior cortex, to aspirate a little bit the blood. And then, of course, we need to detach the hyaloid that we could do. You will see it immediately with suction. Now we could detach the posterior hyaloid from the ILM. We continue to remove some of the vitreous. We can see in the center the macular hole with some blood under the ILM. We detach also from the optic disc the posterior cortex, and we enlarge it a bit, and we detach the posterior hyaloid, removing the cortex. The solution was a little bit uncommon. Here I decided to inject some perfluorocarbon to try to remove the blood from under the ILM. We can, you see how we can aspirate a little bit the blood. I thought this was important, of course, to try to remove more the all the blood. We did a fluid air exchange, and with the help of the bubble, try not to interfere with the macular hole. After we remove the biggest part of the hemorrhage, we switch again to saline, to infusion. Saline, we remove the air, and now you will see I am creating from the initial opening in the ILM. We try very gently to enlarge the break in the ILM in order to be able to remove the rest of the blood from under the ILM. We inject again perfluorocarbon to displace the blood. This we are aspirating the blood from under the ILM. Try not to disturb the ILM because we will need the ILM to close the macular hole. And carefully we remove the blood at the margin of the ILM and now without blood, we are aspirating the perfluorocarbon. Of course, all the maneuvers are done gently in order not to disturb the ILM that we will need to uh, to close the ILM, to close the macro hole. And now, of course, we do the fluid air exchange again completely. And then we decided to use silicone oil, but we have used in this case Densiron. It's it's a silicone oil that will have the tendency to stay in the inferior part. The meniscus of the Densiron is above at 12 o'clock, and with the idea that it will help with the help of the ILM in place to close the macular hole. Of course, we are completing the filling of the vitreous cavity with Densiron, and this is how it look at the end. And of course, we checked that the artery was perfused, and we are removing the trocar. And this was the first operation, and this is the aspect at 1 month. You can see that on the OCT image that the ILM is still detached, and you can see the line of the silicone oil, but it's a very good closure of the macular hole. And after 3 months, we decided, of course, to remove the silicone oil. It is a little bit different because this silicone oil will not float on the water. You see, the image is a little bit blurred because there is a membrane behind the lens. So the anterior vitreous, the anterior hyaloid is a little bit cloudy, but I will show you how we remove it. And that's why the image is a little bit blurred. But we remove the silicone oil. You have to go to remove, of course, the last part of the silicone oil. And when this is not feasible, we can use perfluorocarbon to help the removal of the last bubble of silicone oil. Sometimes it takes time. We are using the cutter on, because otherwise it will be stick with the silicone oil. And we succeed to remove it. I think it was an operation that took about 40 minutes, so it took some time. But of course, carefully we try to remove all the silicone oil, everything that's in the vitreous cavity. And I will show you a little bit. Now you can see carefully under the coaxial light of the microscope using aspirating and cutting. We engage this membrane and we are removing it. Of course, you have to pay attention not to touch the lens if possible. Um, and you see the better view. We can see very well where the ILM was detached, and we do the fluid air exchange in order to remove as much as possible from the fluid and from the oil. The advantage is that this type of oil doesn't do too much emulsification, but anyway, I try to remove it at 3 months. And this is the result. You see the macular hole is closed, the ILM stayed detached, the visual acuity improved to 0.607 after about 6 months. And we were pleased with the result obtained. Thank you very much.
Thank you very much, Florian, for this very interesting case, which showed us many tricks that is definitely useful, and we always learn from you. Thank you very much, and thank you for being our guest this evening, and looking forward to seeing you in Egypt and in Romania once more and more times to come. Thank you very much.
Thank you very much. I'm looking forward to see each other again, as you said, in Egypt or in Romania, to continue our friendship.